You know those ultrasound images people share online when you try to figure out which part is the baby? That picture is only a small part of what diagnostic medical sonography does. This field has changed how we look inside the body, and I want to explain why it matters and why it affects so many areas of the healthcare. Here is the basic idea. A small handheld device called a transducer goes on the skin. It sends high frequency sound waves into the body. We do not hear these waves. They bounce off the organs and tissue at a different speeds. The machine reads those echoes and forms real-time images. It shows what is happening inside a living person while the provider is scanning, which makes it useful for diagnosis and during some procedure. Ultrasound uses no radiation at all. It is safe for pregnant women and children. There are no needles, no contrast dye, and no recovery time. And it is used far beyond the pregnancy. Providers check the liver, kidneys, and gallbladder. They look for stone or masses inside the body. They use it to check for blood clots in the legs. Cardiologists watch the heart valves move. It also helps to evaluate muscles, tendons, and joints. In many cases, ultrasound became the first test patient received because it is quick and available in most clinical settings. Recent research shows how strong this tool has become. In 2022, Kaigo team showed that a newer ultrasound method helps them to detect liver fibrosis without a biopsy. In 2023, Yuan and colleague reported that contrast-enhanced ultrasound helped them to detect ovarian cancer earlier. In 2024, Donors Group found that portable ultrasound helped emergency doctor to identify the internal bleeding faster than CT. In 2024, Diagnostic showed that bedside ultrasound reduced the time patient stayed in the emergency department when checking for possible bowel obstruction. Together, this study shows how ultrasound improve accuracy, reduce risks, and support faster decision for critical patients. Ultrasound is also becoming more accessible. Machines are getting smaller, some are the size of the laptop. This helps paramedics use them in the ambulance and support care in remote area. AI support is also growing. It helps to interpret the image. It reduces errors and supports providers who are still gaining experience. The main point is clear. Diagnostic medical sonography is fast, portable, and radiation-free. It gives answer at the bedside. It helps to detect serious problem early and supports safer care. From pregnancy monitoring to trauma evaluation to routine checkup, ultrasound is one of the most practical tools in the modern medicine. It continues to improve patient outcome in a simple, efficient, and reliable way. Thank you.